Hi and welcome back to our page. If you're applying to become a CQC registered manager right now, there's something that's been catching people off guard. Some applicants are being asked to send over level 3 safeguarding certificates, level 3 medication certificates, and evidence of their full mandatory training before they even get to the interview stage. And other people, well, they're sailing through registration without being asked any of that. So, what's really going on? Is this a new rule? Is it just some inspectors being more thorough than others? And most importantly, what should you actually be doing to make sure your application doesn't get held up? That's exactly what we're covering today, so let's get into it. Welcome back to CareSync Experts. If you're new here, we help care providers across England, Wales and Northern Ireland with registration, compliance, tenders and everything in between. We've supported dozens of registered manager applications every year. So we see firsthand exactly what CQC is asking for and how these requests vary from one inspector to the next. This topic has been blowing up recently. We've had multiple clients come to us confused because their friend got registered 2 weeks ago and wasn't asked for any training evidence. But they've just been hit with a request for level 3 safeguarding, level 3 medication and a full list of their mandatory training certificates. They're thinking, hang on, is this even a requirement? Let me break down what's actually happening here. Let's start with what the law actually says, because this is fundamentally important. Under Regulation 7 of the Health and Social Care Act 2008, Regulated Activities Regulations 2014, a registered manager must have the necessary qualifications, competence, skills and experience to manage the regulated activity. The CQC's own registration guidance says you need to provide a copy of your qualifications and training when you apply. It gives the example of a level 5 diploma in leadership and management for home care services. And it specifically says that for some services, you'll need to show you can handle complaints, mental capacity assessments, safeguarding issues, and medication errors. Now here's the key thing. Notice the wording. It says for some services and show that you can handle. It doesn't actually say you must hold a level 3 safeguarding certificate or you must have completed a level 3 medication course. The legislation is deliberately broad. It focuses more so on competence, not on specific certificates. And that right there is the root of all the inconsistencies people are experiencing. So why is one person being asked for everything and someone else is getting through without providing any training certificates at all? There are a few reasons, and once you understand them, it will make a little bit more sense. Firstly, the CQC is not a single person. It's thousands of registration inspectors and assessors spread across the country. Each one is interpreting the same regulations, but they're applying their own professional judgment about what evidence they need to see. It's not a flaw in the system, that's how the system is designed. CQC's Regulation 7 guidance gives inspectors discretion to determine whether an applicant has the right qualifications, competence and skills. Some inspectors will look at your application and see you've got 15 years of care management experience, a level 5 diploma and a strong CV, and decide they don't need to see individual certificates, meaning they're satisfied. Other inspectors, equally validly, will say, I want to see the evidence. Show me your safeguarding certificate and show me your medication training. Both approaches are within the rules. Second, and this is important, it sometimes depends on what's in your application. If your CV has gaps, if your experience doesn't clearly demonstrate competence in safeguarding or medication management, or if your statement of purpose references services involving high medication needs or complex safeguarding, the inspector is more likely to ask for specific evidence. They're not trying to catch you out, they're trying to satisfy themselves that you can do the job safely. Third, some of you will have seen that the CQC can register you with some conditions. One of the conditions they sometimes impose is a requirement to complete specific training within a set time frame. We've seen some rare cases where someone has been registered but with a condition that says they must complete the level 3 medication management training within the first 3 months if they smash the interview. If you don't have the training up front, this is one possible outcome. And if you want to remove that condition, you have to apply separately and provide evidence that you've done the training. So it's always better to have it if you haven't done it before you apply. So here's what we advise every single registered manager applicant we work with. And this is based on processing dozens of CQC applications, not theory. Get your level 5 diploma in leadership and management sorted, or at least be enrolled and able to evidence that you're working towards it. That's your primary management qualification. And the CQC guidance specifically references it. Complete your level 3 safeguarding training. Look, the CQC's own interview guidance notes that registered managers are usually expected to hold level 3 safeguarding as a minimum. We've had inspectors say directly that they expect all managers to have this by the time they register. Whether it's technically mandatory or not, it's the standard that's being applied in practice. Don't gamble on getting an inspector who won't ask for it. Just make sure to complete the level 3 medication management training. If your service involves administering or managing medication, and for personal care and supported living services, that's almost always the case. You need to demonstrate competence always. A Level 3 medication certificate is the clearest way to do that. We've seen people with Level 5 qualifications and 16 years of experience still being asked to provide it. Your experience is valuable, but it doesn't replace the certificate when an inspector asks for one. Beyond those two, complete your full set of mandatory training as well. That means first aid, infection prevention and control, moving and handling, fire safety, mental capacity, deprivation of liberty safeguards, food hygiene if applicable, equality and diversity, and basic life support. If your training plan references these courses as mandatory for your staff, the inspector may well ask to see evidence that you as the manager have completed it too. I guess that's a fair question, because how can you oversee training compliance if you haven't done the training yourself? And while we're talking about training, there's something coming down the line that you absolutely need to be aware of. The Oliver McGowan mandatory training on learning disability and autism is set to become a statutory requirement for all health and social care staff in England in the second quarter of 2026. The Code of Practice was finalised in September 2025 under the Health and Social Care Act of 2022. If your service supports people with learning disabilities or autism, and you've selected those service user bands in your provider application, having evidence of this training is going to become even more important. CQC is already referencing it in their guidance as the government's preferred training for these services. Our advice: don't wait for it to become legally mandatory. Get it done now. It shows the inspector that you're proactive, that you're keeping up with regulatory changes, and that you take your responsibilities seriously. That kind of evidence speaks volumes in the fit person's interview. Let me give you the bottom line on this. You cannot control which inspector reviews your application, unfortunately. You cannot predict whether they'll ask for training evidence or not, but what you need to control is being ready. And being ready means having every certificate, every qualification, every piece of evidence organised and available before you submit your application. When we prepare clients for registration at CareSync Experts, we build a training matrix that maps out every course the registered manager and their staff need. We include the course level, the provider, whether it's been completed, and the certificate reference as well. When CQC comes back and says, "Can you send us your safeguarding certificate?" our clients don't panic. They send it on the same day. That speed and preparation sends a message to the inspector that this person is organised, they're competent, and they're ready to run a regulated service. Compare that to the person who gets the request and then has to scramble to book a course, wait for the certificate, and delay their entire application. That delay doesn't just cost time, it raises questions in the inspector's mind about your readiness. To wrap this up, is CQC now requiring Level 3 safeguarding and medication certificates for all registered manager applications? No, it's not a blanket rule, but there are individual inspectors asking for it, yes, absolutely, and with increasing frequency. The safest approach to this, and the one we recommend to every single client, is to treat it as if it's required. Get the training done, get the certificates, and have them ready. It removes the risk entirely, and it actually strengthens your application regardless. If you're going through CQC registration right now, or you're about to start and you want help making sure your application is airtight, get in touch with us at CareSync Experts, and we'll make sure nothing catches you off guard. The link to do this is in our description below. If this video helped, leave a comment, hit that subscribe button, and share it with anyone you know who's going through the registration process right now. They'll thank you for it. See you in the next one.